Good morning, everybody, and welcome to today's webinar. I hope you are very warm wherever it is you are in the UK today. My name is Katie and I am the Director of Strategy and Partnerships at Mental Health UK, one of the UK's leading charities in workplace mental health. And we've set up this series of webinars to get really practical about mental health in the workplace. And today's session is a really interesting one because we're going to be talking about how to talk to young people about their resilience through COVID-19. And this is going to be a really interesting session, not just for employers, but also for parents and carers as well. And I'm absolutely delighted this morning to be joined by my colleague Enda Egan, who is our Head of Young People's Programmes at Mental Health UK. I can see you've decided to leave the cat filter off this morning, Enda. Good morning, how are you doing?
Morning, Katie.
Nice
Good, thank you.
Great, super stuff. Now, before we get started, I just want to let everybody know that we're going to be recording today's session and we'll send it through to you a little bit later on this afternoon so that you can pick up on any of the key content again and share on with your colleagues as you see fit. There is also the option for you to submit some questions to Enda. There's a chat function and a question and answer function both on the webinar this morning. So please do, as we're talking, leave your questions there and we're going to protect plenty of time for them as we go through the session a little bit later on today. But without further ado, I'm really happy to sort of kick us off. So nice to see you, Enda. Thanks for joining us this morning. We're hearing an awful lot on the news right now about young people's mental health. And I guess unless you've got kids at home or you're regularly talking to other parents, it's quite a tough thing to get your head around. And so I wanted to just kick us off today by understanding a little bit more about what it is that you're seeing and what you're hearing.
Hi, yeah. I think, to respond to that, I think it's, COVID has had a huge impact on everybody's sort of mental well-being generally. But with young people, it's had a really devastating, toll on the impact. And what we're hearing out there, the most sort of compounding thing that I find very challenging to hear is this sort of loss of hope. Young people speaking, I've been working in the young people's mental health space for over 20 years, and it's rare I hear a statement like that. It's very devastating to hear something like that, where young people just feel that hope towards education, examinations, etc., is gone, and they don't really know what's happening, and also towards employment opportunities and prospects that are ahead of them. And I think there's this general feeling of being left in limbo, that sort of life is passing by, and I'm not having an impact, on how my life goes and what sort of determines that. And I think there's a sense of loss of agency as well. These young people don't really feel they're part of the conversation. And I think a critical part of that is the sort of vaccine timeline. There's no timeline for young people when they will be getting vaccinated, and life will open up and sort of become freer for them again. I think a lot of this is sort of compounded by, over recent weeks, you've seen a lot of research come out about the impact it's having on young people, and the NHS digital data is one, which is just it's sort of 1 in 6 young people are now having mental illness, which is just incredibly challenging. It was 1 in 9, and if we continue to see that trajectory, we are in for times that are going to be very challenging ahead. I think there's also some research that came out with the Youth Index, which was done by the Prince's Trust, which just shows young people's concerns around employment and concerns around their opportunities. A lot of young people feel like 1 in 5 feel like they may have to train again in a different sort of area to give them support about employment in the future, and a quarter of them were very concerned about their future prospects. So I think if you look at the sort of the trajectory of young people that we're discussing today, it's not just in education and just about exams. It's about people's opportunities in the workplace and the future prospects that go ahead. So I think it's we are in for some challenging times ahead, really, with this.
That's something that's quite a profound statement, isn't it? To think that young people have barely even got the opportunity to make their first steps into the workplace or into sort of formal training in a specific area, and that they're already starting to think about whether that's going to be a fruitful journey for them, both in the short term and the long term. I guess that's something, once you've got a few years' experience in the workplace environment, that can be very much a thing that lots of people have to go through. But the prospect of having those thoughts before you've even got a chance to get started is, I can understand how that can be quite a challenge for young people. And so we're talking about all young people when we're talking about when we're going through this webinar today, but I know you have sort of specific expertise, and we've done quite a lot of research at Mental Health UK, in particular around older teenagers and those in their early 20s. And as you've already started to allude to there, it's a time for young people with an awful lot of change already, whether it's moving from school to college to university and into work. But what is it about COVID and lockdown that's really making this a lot harder?
Yeah, I think young people have a lot of transitions in life, and that's one of the reasons why resilience is so important to them. I think if you look at 14 to 18-year-olds, for example, they have a huge amount of transitions, with generally in the education space or going into a new job. And then as people get older, they have changing of jobs, finishing university. So there's a huge amount of change. And I think what COVID has brought is unexpected change. We're sort of nearly conditioned to go to this process in life, which is you go to school, you sit your exams, you go to university, or you go to work, and all of those have changed. And I think it's inside of that, conditioned way that we were before is that unexpected challenges that is bringing up for a huge amount of people. I think what also, there's a loss of sort of rituals and rites of passage, and I think we need to be quite careful about fact that they are very important to young people. They sort of, they signify progress. They signify closing one chapter and moving on to another chapter, and that can be, finishing school and going to university. There are lots of young people out there now who never had that opportunity. A Freshers' Week at university is not just about socializing; it is sort of about integrating into that new space. It's about sort of progressing to that next stage, in your life. And I think there is a huge amount of loss around that as well. I think if we look at young people's goals as well, their goals that they set are very driven by gaining new skills, by starting a new job, getting a new qualification. And once again, a lot of those goals have been changed. And we work, we speak with young people a lot about setting goals and setting goals that are achievable. And all of a sudden that achievability of that goal has been removed from them. And I think that it's causing a lot of anxiety and stress and worry around those things. And I think, connectedness is so important for young people. I think that the complete loss of that, it may well still exist in sort of social media platforms, but it's that sort of connectedness that I think they're really having, an impact on them. And I think that is just, changing things so much for them. I had a conversation with my niece who's 18 the other day about sort of connectedness, and she had, I didn't agree with all her points, but some of them were quite valid. And I think it is, when you're younger, you want to connect with a much broader network, and you sort of cast out your net much broader, because there is a hope that some of these relationships that you create will exist and they will continue. And I think when you get older, you sort of cull some of those relationships, and you are quite clear in who you are, who your network are, and who your relationships are. And I think young people have really struggled with sort of social distancing and with bubbles around that, because there's sort of much broader network of people that they connect with, and being connected to other people, whether it's peers or people in school or people in work, really supports young people's resilience as well. It really helps them to sort of look at what other people are doing, and there's a lot of mirroring that goes on. So I think all of those things, those transitions and that unexpected change that we're currently going through, it's causing a lot of stress and anxiety among young people.
And I guess it's so easy when you're thinking about young people to quite quickly put that very prevalent image of a young person sitting there with their mobile phone in front of them and think, but young people are connected, they're constantly wired to their phone. Surely this isn't too much of a problem. But I think what you're really identifying there is actually much the same as we experience as developed adults, is that need for the face-to-face, that need for the interaction, and those wider cues to continue that development around sort of social understanding and social development.
Yes, definitely. And this, resilience, the near to peer element of resilience is really, really important for young people. It's where they learn from, their friends and the environment around them. And I think that sort of removal of that, and if you add to that this unexpected change as well, where nothing is the same, as it was 12 months ago. And I think all of it it's causing a lot of uncertainty, and that connectedness is something that young people are really craving and really want back, and it is fundamental. It's fundamental to their development and their resilience building as well.
Absolutely. And so we're nearly a year now into this cycles of lockdown that we've been experiencing across the UK, and I think certainly from some of the conversations that I've been having recently, you know, there was a really good sort of understanding of the needs of young people's mental health as we went through that first cycle. But as we've come into the third lockdown again, young people are back to doing their education from home, but it's a slightly familiar turf. It's something that we've kind of been through before. And I'm starting to hear on occasions these comments about, you know, well, we just need to crack through this now. It's almost that wartime style statement of, you know, stiff upper lip, etc. But, you know, when it comes to young people versus ourselves as developed adults, why is this time in their life so important? And why is it important now to develop their resilience?
Yeah, it's resilience is such in the young people space. It's such a buzzword that is you know is flouted around an awful lot. And if you look at the evolution of resilience, even the definition of it, it's changed so much over the last 30 years. This analogy of sort of bouncing back from a major traumatic incident, for example. You know, I was quite rightly put into my place by a young person about 2 years ago who was designing something, and it was very much focused around, you know, I will not bounce back after a major traumatic life event. I will learn the skills to have coped with that event, and I will be different, but I will have learned from what that experience was. So, you know, that's a really interesting, you know, thing that I had put to me when I was, you know, talking about young people's resilience. But I think just sort of on resilience and you know what it is and what we define resilience sort of as. It's not something, you know, you're born with. It's not this sort of character trait that one individual you know has, and then there's another group of individuals who don't have. It's sort of it's something that we do. It's the coping mechanisms that we have and the skills we have to get us through difficult times, you know, times that can be challenging. Now they can vary for young people, and they can be huge events, like it can be the death of a parent, it can be losing a particular job, or it can be down to something that, you know, impacts a young person in a way that might not impact another person. So it's a very personalized you know thing, resilience for young people. I think what's really critical about resilience for young people is giving them the skills and to identify what causes them stress. So it gives, you know, so it's not only about having a tool to address that stress that they may be suffering from, but it's that ability and that, you know, giving them the right and the opportunity to be able to address something that is incredibly stressful for them. You know, resilience for young people, it gives them the skills for life. There are certain situations that they might find very challenging, and I think, you know, a lot of young people, change is one of the things that young people would find challenging, change and transitions. And it's within that change and that transition that we're now experiencing the biggest challenge of our generation, which is the change has become uncertain, the change has become constant, and young people just, you know, are needing to have a lot of resilient skills to cope with it. And I think, you know, we should never underestimate how resilient young people are. Quite often there can be a lot more resilient than we give them the expectation, you know, that they are. But also, it is quite fragile. Resilience can be a fragile state. Some person can feel very resilient one day and not so resilient the next day. And I think that we need to really bear that in mind. And also, you know, major traumatic events like COVID and the impact it's having on people and young people's general well-being, it is what we would consider a major event for young people to go through. You know, we should be giving young people these opportunities to have skills for life. We should be supporting them in ways that they can identify things that cause them stress, no matter how big or how small that they are. And that way we could just encourage them to develop those tools and resources that they can use, you know, but now and as they go throughout life. The young people right now are going to be, you know, talking about this in 10 years' time, about how important it was for them to build resilience around, you know, this situation. We're hoping that in 10 years' time we're not going to have a similar situation, but it's all, you know, it's a really important training ground at the moment, I think, for young people to build their resilience and for us to support them in building it as well.
So I think what you've really encapsulated for me there, Enda, is that, you know, this is a time where we really should be focused on young people's resilience and young people's mental health, and the fragility of the situation that we're existing in as a society at the moment gives us something that we really should be concerned about on the whole. And this isn't just an instance for a few young people. This is an instance for the many here. At Mental Health UK, we often cite the statistic that 75% of mental health problems start before a person's 18th birthday. So it really is proven to be a challenge for many young people at this age. So starting to think about having a conversation is something that requires an awful lot of tact and an awful lot of thought. And before we perhaps get into talking about what some of those questions might be that that you would use and that you would have with the young person that's in your life, let's maybe just talk a little bit about scene setting. What would be your sort of top tips to get that right before even instigating the conversation in the first instance?
Yeah, I think the first couple of things that people should really consider are is not to be concerned about having these conversations. You're not expected to have all of the answers when you sort of embark on that journey, because it can be a journey into that conversation with young people. It is, you know, it is feel confident and comfortable enough to go into the conversation. I think the second thing is really important is to be looking after your own well-being. I think young people mirror a lot of what they see and what they hear, and I think it's, you know, it's really important to remember those two things. We use the 4 Ps. So it's all about planning to going into these conversations. And the first one is sort of plan what to say. If you're going into a conversation with a young person about mental health and the resilience, it will generally be because you might have identified some, you know, there might have been emotional or sort of verbal cues that has made you feel like you need to want to have this conversation. So, you know, prepare yourself. There are a lot of resources out there that can support people when they're having this conversation. Plan the best time to have this conversation. Don't have this conversation while somebody is busy. You know, young people have schedules, young people have priorities as well, and they should be protected and valued, and they shouldn't be trodden on. Don't plan to have this meeting when you're, you know, running out the door while you're doing other things. I think you need to protect the time. And you know, you generally know young people and when it's the best time to have these conversations. When you're at home, it will be in the evening when everybody is slightly more relaxed and you're watching television or going for a walk. When you're in the workplace, if somebody is you know, meeting deadlines and sort of priorities, it's not the best time to probably plan to have these conversations. I think the next P would be to sort of plan how you're going to open up the conversation. And so much of this is about how you approach it from the start and how you get that young person to open up. It can be easy for a conversation to get shut down quite quickly if somebody doesn't feel comfortable about what, you know, they're going to speak with. So if you're planning what you're going to say and where you're saying it, you know, you should be able to open up the conversation in that way. And I think one thing we can forget quite often is you need to plan what will happen after the conversation. Young people have had a lot more conversations than I have, for example, when I was younger, about how I am, my well-being and my resilience. There is a sort of conversation in the young people space now, which is we have been told to open up and talk. What are you going to do about it now? There's been, you know, hugely successful stigma campaigns that have encouraged young people to be able to talk and open up about how they're feeling. If you're going to, you know, embark on this conversation, have a plan of what you're going to do when something comes up. You know, and on that point, at the moment, there is a fine line, you know, between somebody dealing with and emotionally dealing with a traumatic situation like COVID, and also the presentation of someone's mental health. So if somebody is not well enough, and if is not, you know, you do not feel like they're coping, don't be afraid to take action on that as well. So all of this is just, you know, planning. I think it's the best way to go around conversations. And what you might find as well is some of these tools might be very supportive towards you yourself. And I think you would feel much more confident going into the conversation if you have done that planning right.
And I think one thing that I've taken away from what you've just said there, Enda, is that actually with the prevalence of conversation about mental health being much higher now in this country, there is potentially almost an innate expectation in young people that somebody is going to have this conversation with them. So, you know, being prepared for that as well, I think is something that's very important, and also to prepare for what will happen after the conversation. So those 4 Ps sound really interesting. So perhaps that's something that we can share with the delegates after the webinar this morning. I think that would be really helpful. So we've got our preparation. We've planned and we're as prepared as we possibly can be to have that conversation. Talk us through then, what's the general construct? What are some of the key questions that you think are most important in this space?
Sure. And I think, you know, once you've done your planning phase, if you sort of move the needle along and go, I think when you're starting the conversation, the first thing to do is just be open and transparent. is really explain, why you're having this conversation. Once again, a lot of that is towards planning. I think if you catch somebody off guard, and somebody is in the middle of doing something, and you walk over and say, "Oh, I'm really worried about your mental health," it's not the way to approach it. So I think explain to people why you're having the conversation. Be open that you may have noticed something. I think that will open up the sort of gateway to allow people to have a conversation about how they're feeling. So be very open. Just say, "I have noticed things. I am concerned, and I would just want to have a conversation with you about this." So I think it's that transparency will allow that sort of conversation to open up. I think you should really focus on listening and acknowledging. I think it's going back to, you're not there to provide all the answers. We're not expecting everybody to have the answers that, some of the challenges that may come up during the conversation, or some of the things that young people are concerned about. Don't be afraid of that. Don't be afraid. You're there to listen and acknowledge. And as we touched on earlier, if you have to signpost to other support, do that, and do that confidently. And I think if you are being open and you are listening, acknowledging, that will encourage the other person you're speaking to talk about that. I think try not to panic. Try not to panic if there is something that is challenging. I think it's this listening. It's listening and sort of normalizing the conversation. I think we're very good now at speaking about everybody having mental health. I think we're very good at comparing mental health to physical health, and I think bring those learnings into your conversation. Everybody has mental health, and it's on a spectrum, and I think young people will appreciate that. Young people will know most of this, and I think that's why you should be going in with sort of listening about it as well. And also, there's quite a bit you can learn from what a young person comes back and says to you, and just make sure you can do that as well. I think sort of empathize. Young people respond to empathy. I think that is really, really good. That you just empathize with people when you're going through. They will generally respond better if they're feeling listened to. It's really, really easy for you to listen to what people are saying and just have that empathy with them. And I think finally, don't make assumptions. Don't make assumptions about how somebody is feeling. Don't say to them, "Oh, you know exactly how they're feeling," or "Oh, I felt like that myself." It's very much about listening and sort of empathizing with people, and not making assumptions around how they are feeling, because they are their feelings, and it's just about being supportive around that as well.
And what would your recommendation be, Enda, if a young person sort of asks you back about your own mental health or about your own mental well-being? Where should we sort of set the line in terms of what we choose to share back with someone?
Absolutely, I think it's a really positive way is to talk about your experiences, about yours, and it's not sort of use yours to compare to theirs. If you understand it, it's a conversation about because we all have mental health. We all have times that we find life more challenging than other times, and I think really on resilience, it's really important to talk to young people about the tools that you use for your resilience. So it's yeah, absolutely, Katie. It's been very open about that you have gone through certain things, you have experienced certain things, and I think being quite solution focused about that as well. It's like, this is what I did at that particular time, and this is how I supported myself at that particular time. I think what's also really useful as well, particularly around resilience, is going through resilience tools with young people, and that really supports that conversation you're having with them. The resilience graph that we use quite a lot is a really interesting tool for people to use, where you can look at the certain parts of the day where you felt more resilient than others, and if you look at that over a not even a significant period of time, a few days, you can identify patterns sometimes. So these conversations should very much be supported by tools as well.
Great, and that leads me on very nicely to my next question, because at Mental Health UK, the purpose of these webinars is to be really solution focused and to throw open our doors and support everybody that's listening today with the full repertoire of tools and activities that we have to go away and have these conversations. So what have we got, Enda? What do you think that we can share across to the team? We'll get some things out on email later on today. And what else have we got on our website?
Sure. I think probably the most important thing is the 4 Ps that I touched. So we should send out the 4P plan, to sort of planning a conversation with young people around mental health and resilience. It's an adaptable tool that you can use for any conversation. And I think it just sits there and it supports you when you're sort of planning to go into that conversation. You can very much share that with a young person while you're in the conversation, or you can just keep it separate. But for you, it's a really useful tool to embark on that conversation. I think we'll also send documents sort of supporting employers to support the mental well-being of younger employees. I think, as I touched on several times this morning, we do see a lot of, there is research that's come out that younger people are that sort of cohort in the workplace who seem to suffer from mental health the worst, and depression is, they're twice as likely to be depressed and not as likely to come forward with their concerns. And that to me is quite alarming, because they would have had support in the education system. So there's some work I think we need to do on that transition from education to employment. So we will send that out as well. And I think it might be also good to send out the resilience graph, because it's a really simple, useful tool for that I find very useful myself. So it's not just for young people, but it's a great tool to use to just sort of map out how your day is going and look back on it over a week. And you can identify patterns and trends. So we should send those out.
Super. I won't under that, but we'll make sure we get all of those together. And as I say, once we've got the recording of today's session, we'll get that one out to everybody that's listening in. And I think just one final question for you, Enda, before we sort of take some great questions that have come through already from the audience. If you're really worried about a young person's mental health, what should you do?
Yeah, if you're really worried about a young person's mental health, this goes back to what we said earlier, is don't be afraid to take action if you're worried. And I think it is, contacting the Samaritans or calling 999. You will go into these conversations, and there might be things that, you will have them generally because you might be concerned about something. If you're worried while you're in the conversation, don't be scared to do something else, just take action.
Great. And so Samaritans, and of course, if absolutely required, then there's always the ability to dial 999, and the emergency services will be there to help. Listen, thank you, Enda. We've already had a smattering of questions come through from people who are listening in today. But the first observation was that from a gentleman who says he's seen a lot of teens at work who are not at school and are bored and are hanging around shopping centres, and I've seen a rise in teens smoking cannabis. You obviously do quite a lot of work with schools at the moment. Do you have much sort of intel on attendance rates? Presumably this is something that's quite challenging without having the class register in the traditional sense.
I think it throughout the UK it varies a lot. I think some schools have become much better at the transition onto online teaching, and some schools have not. I think what's really interesting, what's been said, is that what we are seeing is the presentation of a couple of mental health conditions. So substance misuse, for example, is coming up to the surface again quite a lot. It's always been around, but it's not something that has been discussed that much in the space recently. And also eating disorders as well, I think, is coming a lot more into the space, and concerns raised around that. I think it's very much, it depends on the school, and it depends on what sort of mechanisms they have in place for getting young people to attend, and what I think a lot of this we will start seeing when the schools go back, and we will start seeing the impact of what this is happening, because there's going to be a lot of loss of learning that's going to be happening as well.
Super, thank you. Lots of questions coming in here, so I'm going to try and pick off as many of these as I can for you, Enda. But I've got one that says, I'm a line manager of a parent who thinks her son is struggling with his mental health and with lockdown. What can I do to help her as a manager?
Yeah, I think that's a really good question. I think we come across this situation quite a lot. I think it's about being open and having that conversation. I think you can go back to sharing what we will share, which is planning around that conversation. I think look at what your organisation has in terms of supporting employees and supporting young people around that. There's a wealth of resources that are available. And Mental Health UK, we have a resource library which is specifically for younger people. So you can sit down and give people those tools and guides that they can use to go through it. So I think it would be very much about having that supportive conversation and making those tools accessible to staff members who may be going through this.
Great. And so what we're saying there is we've got the opportunity for the line manager to share through with the parent the tools that we've got available. And I think from a workplace point of view, what we'd probably also recommend is for the line manager to think about the sort of the accommodation and the adjustments that they can give to the parent, because if a parent is constantly thinking about their child's mental health, then they're not going to be present in their day job, and they're not going to be able to focus in the way that an organisation or an employer would expect. So it's about recognising, actually, and particularly with the sort of the working environment that we're in at the moment, and having already had to give so much more flexibility, where else can you give the space for that parent to take the time out to have those conversations, to reflect, and accommodate the work in elsewhere? I think that's a really great question. Another one that's come through here, Enda, is why do you think that young people are less likely to disclose around mental illnesses?
I think young people are generally quite good at disclosing about their mental illness, and they're generally quite open, in having those conversations. I think the conversation around mental health, and therefore and also mental illness, I think is making that sort of clarity between the difference between both of those things. But I think young people generally can be quite good. I think if they're not able and open to have these conversations, I think that's something that we should be taking action and actually going in and having conversations. I think a lot has been done to reduce stigma for mental health, but it hasn't completely gone. And I think some people may well not still be comfortable about having those conversations. So it's just about, if you feel like young people are not having conversations or don't feel comfortable, I think it's our responsibility to have those conversations, to go to those steps as we discussed, about asking them to open up, about sort of planning how you go in and having that conversation with a young person.
And you mentioned earlier, Enda, that you think that there's a difference between disclosure in their home life and young people's disclosure in the work environment as well. You talked about that being considerably lower. Have you got much of a view as to why that would be a bit of a different circumstance?
Yeah, and I think it's younger people in the workplace are not as prepared to come forth and talk about their mental health than older employees, and that is the surprising thing, because younger people will, through the education system, have had more conversations and had more openness talking about mental health. I think a lot of it is we need to understand what generation somebody has come from in the workplace, and we need to make sure that one thing that's really critical is that sort of onboarding process, is having an open sort of conversation right away. I think organizations having that sort of systemic change where they have policies that allow this sort of open conversations. They have mental health policies and guidelines that exist inside the organization. And I think what we might find is younger people are much more comfortable in their groups of friends and networks to have the conversation. But what we need to do is shift that to them being feeling comfortable having it in the workplace as well.
Super, thank you. I've got a question here. It's quite long, so I'm going to focus in so I make sure that I do this one justice. But it says that my daughter is not very young. She's 26, but moved out of her own place on her own just last January, 1 year after also losing her grandmother, who she was very close to, then COVID, plus she works for a theatre, so she's really struggling. Would it be possible to share lots of tools for resilience, or tools on how I can help her when she's not living here? We speak every day and she's in our support bubble, but we still can't use the cuddle or the hug. Any advice on tools that can be used remotely would be welcome.
Yeah, sure. And I think that this is a really critical point, is that the absence of that emotional contact, and where somebody might be, you might be able to see each other on a Zoom, but actually missing out on that contact. I think very much, definitely we can share the tools. I think if we share the tools that we mentioned there, would be quite useful. And I think they can be shared with people who can use them on their own. And some of them are, they are engaging tools that you can have continued conversations with around them as well.
Great. And similarly, we've got a couple of questions here, which I'm going to try and merge into one. And that's around new graduates who haven't worked before, and induction processes. Presumably in most organisations taking in fresh graduates at the moment, they're going to be doing so remotely. Again, how transferable or translatable are these tools in that environment? And is there any other recommendations you'd make around induction?
Yeah, definitely. I think that this is a really important point. There's the loss of the sort of water cooler engagement points that anybody has with a new job, where they would bump into colleagues and have a quick conversation with them. I think it's quite easy when we onboard new staff is to sort of start working with them on their work plans and you know their targets and their achievables right away. I think we need to spend quite a lot of time inducting people in ways that are different than they were before. I think there's some interesting ways where this can be done interactively. I think there's lots of interesting things going on there. I think what's really important about this as well is understanding that one size doesn't fit all, and that different sort of staff members are going to need different levels of length of induction. I think get to know the people and get to know what is actually working for them. Recent graduates, they are in a very unique position, which is I think for a lot very challenging. Is they have gone from university into their first job for many, and they haven't had that. Walking into their new office, they had never had that. So I think it's very much about building that relationship with them, getting to know them, and finding out what is happening for them, and then just tailor what you're going to provide them, around that. And I think it's just not to sort of feel that it's whatever one thing will fit for all staff members. I think it's a very personal thing right now, and invest in that induction, extend it for a bit longer. We're not going to be in lockdown and working from home forever. So if managers are panicking by what I'm saying now, it's extended for a little bit longer and give that more investment, set up team lunches and all of those kind of things to really help the person feel included when they start a new job.
Super, thank you. I've got two questions here. I'm going to read them both out to you, but I think they're broadly in a similar space. One is that you refer to the transition from school and the support young people receive in school. Do you think schools are doing enough given the challenges and budget strains they are facing? And how could schools do more? And then the second question is, what can schools do to increase interactions? As a parent of a year 9 who attends all of his lessons, but with cameras off and minimal chat. Okay. So yes, institutionally, what could schools do more? And then what could schools do more in the classroom?
From all our work with schools and colleges, we know teachers want to do as much as they can. They're teachers because they want to support the well-being and they want the best for young people that they educate and teach. They sometimes do not have the resources and do not have the tools to actually do that, to support young people around their mental health and their resilience. There is a lack of funding that goes towards it, and schools have lots of different priorities. It's very much seen as a priority for the majority of schools that we work with and engage with. I think it's very important for mental health charities like Mental Health UK to support teachers, to be the experts in that mental health space, and to not just provide them with downloadable resources, for example, but to actually deliver programs with them, to train teachers up and to sort of encourage them and to give them the confidence to do it, because they really do, they do want to do it. So I think the more and more it's becoming a priority in schools. I think we've certainly hit a point where it's now the top priority for a lot of schools. If you look at a lot of the sort of re-engagement plans going back to school are not just going to be around academia, they're going to be around the general well-being of them. So I think the majority of schools do what they can within the resources they have. And I think there's definitely a role for mental health charities to support them around that, and a role for the government as well. This sort of second question, Katie, was around...
The two elements of it was one around sort of the institutional support to mental health within schools, and then the second element of it was around specifically
cameras. Yeah, and I think we've had different experiences with different schools. Once again, different schools have different policies and strategies about not allowing classes to take place without young people having their cameras on. It would strongly be encouraged that if you are educating a young person, that you have your camera on to ensure that that's the person that you're speaking to. And I think, as a parent or as a carer, what would be really positive is for you to have those conversations with the school and say that you do not feel comfortable with that. But different schools have different sort of levels of expertise, I think, with doing online training. I think there needs to be given some sort of leeway around some of that. But I think it's about having a voice as well and speaking to teachers about you not feeling comfortable about cameras not being on, etc. So, I think schools majority are doing what they can do within the resources that they have. But they've got a lot of teachers, I think, join to be teachers, not to be mental health workers per se, and we need to support them with that.
Absolutely, an unenviable couple more questions for you here, Enda. One is, what is your opinion on whether the promotion of mental health within schools should be enshrined in law and that on-site counsellors should also be a requirement?
Yes, I completely agree. It should be. I think we were making huge progress towards that until COVID happened. I think a lot of schools now will work with, have mental health leads, and we'll have various people who will, support that. I think it should be enshrined. I think it's become such a fundamental part of growing up and of the education system now. I think that there is a real interest from the school environment, for teachers who understand that the performance of a young person in education will not be its best unless their well-being is at its best. We have a real role, and schools are the sort of training ground for that, to build young people's resilience so they can have the best outcomes for life, and a good go at life and learn those skills to sort of navigate life. So I think it's on its way. I think it was coming quite quickly, and then we had COVID, which has sort of knocked it back, quite a bit. But I think, as we'll find out, as we sort of come out of lockdown and go back into education, and young people are going back into schools, there will have to be greater priority put on this, because it's going to be essential going forward.
Super, thank you. And we've got one other question here for you. It says that our local law enforcement and youth teams don't seem to be interested when we pass on our concerns about local youths potentially suffering with poor mental health. Who do we speak to if these avenues fail?
Yes, I would say go to the people who are the experts in it. I'd say go to your local children and adolescent mental health services. All local areas will have particular CAMs that are attached to the local authority. They're the people who have that expertise, and they're the people who will take that seriously. They have very extensive long waiting lists because due to the amount of people who want that program, but they do have helplines, and they do have places where you can report such things. So I think it would go to the people who are specialists in this, and go to the people who will see this as a concern.
Super. Listen, thank you so much, Enda. I think we've asked you an awful lot of questions there that have gone through to the audience, and I've certainly found today's session has been really useful to me. I think my sort of reflections on the session so far is that this is a conversation that is required first and foremost, that young people are still in that developmental phase, and the importance of developing their resilience and having conversations about their mental health is extremely important, and that's something that we should all take away today and think about in the context of the young people that are in our lives. And then in terms of how we have that conversation, you've talked about some great tools which we will send out to everybody a little bit later on today, but the crux of it is making sure that there is that supportive and warm environment before you get going, and to think about some of the questions and to really be in listening mode, which is really helpful to hear. So thank you so much for that. And thank you for everybody who has joined us this morning. I hope you've enjoyed the session. Before you go, I just wanted to let you know that we have our next webinar planned for 10 a.m. on the 26th of March. And we're going to be talking about how to use campaigns and awareness days to develop the conversation around mental health in your workplace. And for that session, we're going to be joined by Stephen Rowe, who is the Chief Marketing Officer for Pure Gym and the Head of Communications and Marketing at Mental Health UK and Ant Nike. Thank you ever so much, everybody, for joining us today. I hope you have a fantastic Friday, and make the most of the snow if you still have any, and if not, keep safe anyway. Take care.
Thank you.